So many people have been waiting to hear all about color and whitening and lightening, isn't it? Hi Resha, hi. Janu, mama English and Sinhala dekema kata karanna. Hi Masha. Hi Danu. Okay, so we have approximately about 75 plus people. Hi Sharit. So today I am going to talk about a most important topic that is bothering everyone, and we hear opinions of every other person regarding this topic. So I thought we'll bust some myths about skin whitening and skin lightening. Now, number one, we are born with our skin color. We can't help it. The skin color that we have depends on our parents, from our mom and dad, and sometimes some kids, their color depends on maybe the grandmom, granddad, aunts, uncles. So basically our color depends on our genetics and our hereditary. So if you have, let's say, a foreign, like let's say if you have a Caucasian parent and a South Asian parent, then obviously sometimes the child can get lighter. If you have Asian, like a Chinese, Japanese ancestry and a South Asian parent, then the kid can look like a combination. So our skin color, basically, we are born with it. Now imagine, no matter what we do, we can use skin creams, we can have oral tablets, we can have IV injections. Whatever we do, the next layer of skin that comes will come what we are born with. Imagine when we color our hair. Like, I love coloring my hair in all sorts of colors, but the next growth happens in the color that we are born with. So most people talk about having lighter skin. Can you guys hear me? Yeah, okay. So most people, they want to have lighter skin. Now I went through the comments in my post that I posted about this live, and very correctly, like Nora had mentioned, the reason why most people want to have lighter skin can be so many different reasons. Number one, it can be because of the biggest reason is because the cultural reasons. Number one, if Nora had really mentioned this, if you open up a proposal page on a Sunday paper, or a Sinhalese or English, whatever language, all you can see is if it's a bride, most parents ask for Sudu, Rumat or Pahapat, Sihin, Taruniyo, right? Like when it goes to the boys section, no girls' parents ask for, fair, slim boys. But in every single 95% of marriage proposal, paper sections I have read, it's absolutely Pahapat Zihin no Pahapat Rumat Duet Soena, right? So it's hilarious, it's sad, because mothers don't even want the girl to be educated, intellectual. That is not a prerequisite. The color is a prerequisite in these South Asian countries like ours. It's sad because, I had a patient recently. I had so many patients. I'll just give you an example. This girl said, "Doctor, I am 28. I have 3 degrees, including a master's degree. I earn very well, but I have seen about 25 proposals, and each time I was rejected because of my skin color." Now, we can talk all about, colorism, and is my video blur? Mayu is saying that my video is blur. Okay, all right. So, it's really sad. I had a university student last week who came to me. Actually, her roommate brought her to me because she has tried, committed, tried to commit suicide because she was bullied in university. She was bullied in, by other guys because of her skin color. So this is really sad. Last month, I had a mom who brought her daughter. She's just in grade 2 of a really famous school. So the mother was like, the daughter has got a rash all over her body, and it has been all over the body, and the mom has been quite confused why. So to see the Surf Excel washing powder that the mom has bought for 1 month has got finished within a week. To see this little girl has been washing head to toe, she's been washing her entire body with Surf Excel because the other kids in her class has been bullying her, saying that they have not been playing with her because she's not a fair kid. So apparently in this classroom, fair kids were supposed to be from good families and dark kids were supposed to be poor. So we live in a society where color is really, really stigmatized. Now, so these are the reasons why people opt for, they want to apply anything that people say, "Davas tuneng sudu venawa, davaseng sudu venawa," they just lose their education, whatever they have learned when it comes to color. Now, also on the other side, in Sinhalese or in our South Asian folk stories, you guys must have heard the evil person usually is depicted in a dark way, like the devil or the evil person is depicted in a dark way, and the angel or the good person is colored as a fair person or a white person. So even in our folk stories, even in these stories, we are from our childhood, we are kind of trained to think that fair equals good, dark meaning maybe bad or wrong. Also, remember, we as South Asians, the third world countries, most of us, we were governed by white people, right? And we have this class society, like this, caste system, where higher the class, higher the job, people used to be fairer. Why? Because people who used to be of a higher caste didn't go out to work, no, so they were obviously lighter. And obviously for the mix of these British, Portuguese, Dutch people, they invaded us. So we, in our mindset, we think that white is superior. It's not. So this is how we have been brainwashed to think. Now the poor girls and boys in this society, this era and generation, still have this mindset in their mind, and they think being fair is everything. Now, just like Savani in my post, Savani had mentioned, describe about the toxicity of having fair skin to society, right? So that is what I gave you a couple of examples of my own patients, so that these things are really happening in society. Now, keeping the social side apart. Now, what are the other reasons why we want to have or lighten our skin color? Now, number one, if you go out to the beach, we have a beautiful beach, we live in an island. So when we go out to the beach and we get tan, our boys love playing cricket, outdoor sports. We like going outside, pool, swimming. So then when we go out, what happens to us? We come back about 5-6 shades a little darker than what we used to be. On the other side, when we have hormonal changes during pregnancy, especially sometimes when moms are pregnant with baby boys, during pregnancy, even with girls, you get this dark neck, you tend to get a little darker. Then sometimes for hormonal changes when it comes to menopause, so in menopause also, you must have seen our moms, aunts, their face, changes. They get these dark blotches all over the face. Sometimes, as girls and boys, South Asians mostly, our intimate areas, inner thighs, groin, pubic areas, underarms, sometimes even the buttock area tends to get darker. It's quite normal, but sometimes it's a little too dark. So then we try to look for options to make these areas lighter. Now, in my opinion, I hope you guys can see me. So in my opinion, even Nadisha has mentioned this, having clear skin. Now, if you have acne and acne scars and have thick facial hair growth, all of this, if you don't have clear skin, there's no point having white fair skin if you don't have clear skin. So it's very important for us to focus on having clear skin. Now, just to ask you guys, okay? Now, if Beyonce, Rihanna, Oprah Winfrey, if they just come over here, right? I don't know about you, but I just go crazy. I won't give a toss about their skin color because they have talent. Their skin is beautiful. They're maintaining themselves so well. They're absolute power women. And that is what we admire, right? Like, if you have no class, if you don't have like proper education, if you're not a good person, if you're not talented, if you don't use your, God-given gifts, you're just trying to be white or lighter, that is not everything in life. Even in relationships, girls could think that all guys want is to have a fair wife. But in reality, right, it can get you to a proposal, it can get you to a relationship, right? But what makes you live longer, what makes the relationship work is everything else. A wife or a girl or a partner who is who can use her mind, who is creative, who helps the relationship, who plays an equal role and not just fair skin. But unfortunately, because we have this culture of proposals, give me a second, guys, I really need to. Okay. So because we have this culture of proposals and arranged marriages, having lighter skin sometimes really does bother us. So also, if I give, examples of guys, if Barack Obama, if all, these cool hip hop, rock, R&B musicians, if they, at any point, if they come, there are hundreds of sportsmen and women, Serena Williams, even our sportsmen and women. I mean, they are so amazing. We don't look at color when we admire a person in this day and age. So I really want you guys to actively change your family's thinking, change your way of thinking, that we always think about fair when it comes, or white when it comes to giving value to a person. Now, keeping all these things aside, now, drum roll, comes the $1 million question. How do we maintain a lighter complexion? Right? Yes, example, The Rock. So, how do we maintain a lighter complexion? Right. Now, this is, I'm not promoting skin lightening, but like I told you, if you've gone through childbirth and pregnancy, if you are suntanned, most people, they asked me on my Instagram, I said I will answer your questions, what you've written in the comment section. So some people has asked, how do we lighten the skin when it's tanned? Some people have asked, when it's hormonal, how do we improve it? So for these, and also for underarms and inner thighs, how do we improve the darker complexion in these areas? Number one is a very good skincare routine. So what we do daily is really, really important. So you have to have a proper skincare routine if you want to have a brighter complexion and if you want to lighten hyperpigmentation, right? So this includes your cleanser, your morning antioxidant serum, your morning cream, then your sunscreen, also then your night serums and your night creams. So please check if you are using the right product, and also at least once in your life get a medical consultation rather than picking and buying from variety of stores what other people use. Now I have these days a multitude of young girls who come to me after using these glycolic, containing products, lactic acid, glycolic acid, AHAs, BHAs, when I have so many young girls and boys who come. So what they say is, "Oh, it worked so well. Initially it was very good, but I started getting acne, I started getting pimples after some time." So yes, whatever is in the market, most of it is good products, good brands, what I mean is. But sometimes, depending on your hormones, on your environment, it could be the wrong choice for you. Maybe it worked brilliantly on your friend or someone else, but it could be the wrong choice for you. So you just ask from someone who really knows about skin before buying your products. That's one important thing I want to tell you. Now, number 2. When I explain to my patients, I really like to use examples. When I talk to patients and they ask me about these lightening and skin brightening methods, what I say is, "Ape hama pittala bahanak wage." Our skin is like, or we are like a brass lamp, which means brass udala maddama, our skin is really, really good, glossy, shiny, beautiful. But podak tiyala tiyanakota, duvili vadinakota, oxidize venakota, it gets, just you lose the glow. So ape hama, it's like that, right? Like our skin. So when we have a skin routine, when we are eating well, drinking, eating fruits and veggies, we are having a good, diet, then our skin becomes so good. But, as life goes on, when we are stressed out, when we work constantly in front of a laptop, right? Laptops emit HEV, high energy visible light. Then, when we have hormonal changes, closer to periods or, in pregnancy, most ladies, they get like, they lose their glow sometimes. Some people get a glow, some people lose their glow. And, all these things can make our skin dull. So if you want to constantly have great skin, you will have to have a nice plan, good skincare products, and also maybe combine some treatments to it. So number 2, if your neck, your elbows, your underarms and your inner thigh, your private areas are dark, then please don't rub 101 things. It's really bad because these are very sensitive areas. Underarms have, sweat glands, your inner thigh, your private areas, it has a lot of glands, very sensitive skin. So don't apply bleach creams or unwanted things and get the skin ruined. Please talk to a medical doctor or a highly professional cosmetologist, and you can get some medication prescribed. So there are some intimate lightening medication, not just beauty creams, medication. Also, you can combine it with really, really great treatments such as laser, peels and all, and it works wonders. You can raise your hand with confidence. You can wear any pair of shorts. You can wear a bikini. You can go to the beach. You don't have to be uncomfortable. Please ask and get the right treatment. Now, some people, they tell me, how do I make my entire body one color? I at least get about 10 of these questions per day. Guys, you can't make your entire body one color because remember, when we used to go to school, socks dana kalla හැම වෙලේම it's fair, like it's super, like you can't wear a shoe because you can't wear a dress because or a slipper or a socks andinakotta, so it's always fair. and with dangalala sellam karanakotta arms, face, the rest of the exposed area tend to get darker. So sun exposed areas, right? So face, arms can get darker, right? So what do we do to make the entire complexion uniform, right? So the entire complexion to be uniform, number one, again, if your face and your arms are getting darker, go to a doctor and get a good skin brightening routine, right? Because it's impossible for you to apply a cream, face, arm, fingers, elbow, underarm, stomach, back, legs. I mean, it's ridiculous. No, you can't apply a cream every single little part of your body. But you can kind of focus if your face or arm, underarm, particular area is getting darker, you can have a proper routine. Yes, so number two, you can opt for a nice antioxidant supplement, oral supplement. Now again, you need to, I'm really against Tom, Dick and Harry prescribing vitamins, because even you can get side effects by overdosing vitamins. As you might know, sometimes you might not know, vitamin A, D, E and K are fat soluble. So if you take months and months and months of vitamins, and if you get overdosed, sometimes you can have side effects of that, right? So at least it's not a joke, guys, right? So ask someone, but if it's right for you, right, you can, because sometimes when you have certain genetic disorders, you can't even have high dose vitamin C, So if you have certain blood disorders, you can't have products or vitamins containing a lot of iron. So you have to really do things responsibly. Just because someone, says a product is good, you need to respect your body, and you need to ask someone before you put something into your body, like a tablet or medication. So definitely oral vitamins and antioxidants are really important if you want an overall glow, which you can take for about a couple of months. Now, so next, tablets. I'm getting a lot of questions about glutathione injections are good or bad. Tablets and IV injections both enter the bloodstream, right? So number one, let's talk about, let me come to that in the end, because I'm following a plan, a patterned way of explaining things to you guys. And if you think this will be helpful to some person please ask them to join the live session, because in the end of this session, I will be inviting one person to join live with me to ask your questions. So, yes, I will smile more. So, now let's say if our mom or aunts or someone, if you have a hormonal pigmentation, right, because of changes in hormones or anything, if you have a pigmentation, then you have to use a nice skincare product, a routine, a proper routine. And I would really advise you to use products that, because I see most of my patients, they tell me they've been using a particular cream for 6 months, for 8 months, products which contains hydroquinone, tretinoin and steroids. So most, they mix tubes together and they apply, so when you apply products which contain hydroquinone, it's so sad. Some girls even use these all over their face for months and for years, and they have like such thin skin. You can see podi valiyata like pimples. You can see tiny blood vessels on the, those capillaries on the skin, and they've got absolutely ruined skin, right? So even sometimes the older generation medication contains a lot of hydroquinone, Of course, it's a good medicine, but you have to only use it for a few months. You can't use it for a long time. So, you need to use medicine which contains, hydroquinone can really reduce faster, but long term it's a disaster. So that is why in new cosmetic medicine, we prescribe things which you can use long term and with less side effects or no side effects, right? So, kojic acid, alpha-arbutin, they're really, really good. But for significant pigmentation, it's not really enough, So you need to have a proper skincare routine. And guys, you can combine or you have to combine beautiful cosmetic medical treatments and it works wonders. Just imagine if you want to lose weight, right? You're 80 kilos and you want to be 60, right? If you combine oral like green tea, supplements, if you follow a good diet, and if you work out, if you do all these things, you will lose much faster than one person who just does one thing. So similarly, if you want to lighten up the pigmentation, underarms, face, wherever, quickly, you can combine a really good skincare routine with cosmetic medical treatments by a qualified, well-qualified professional, right? Exactly, Food Mood Colombo is telling me the thing is always the effects fade off when discontinued products. That is why, darling, I always tell my patients, yes, just like we can't change biology, right? Just imagine if you are a chubby person and if for the slightest thing, if you're gaining weight, right? Just because you went to gym for 3 months and you dieted and you lost the weight, if you stop it, right? If you stop dieting, if you stop working out, what will happen to you? If you're a chubby person, you get back, you get the same weight again. Your hair is growing constantly, you keep cutting it. Just because I did my haircut last month, I'm never going to cut it. We can't say that, right? So skin also, if you want to maintain it, you have to, if you want a particular result, you have to maintain it. Simple as that. But the problem is, most of you guys, most of our people, they just see this post. දවස් 3න් සුදු වෙනවා. දවස් සති 2කින් සුදු වුණා. ඔක්කොම පැචස් සතියෙන් ගියා. සති 2යි කලර්ස් 10ක් විතර මගේ පාටෙන් අඩු වුණා. Right? They just lose, everything that they learned in school, lose common sense, and they use all of these products and end up having absolutely ruined skin. So you have to be realistic and you have to have a proper plan. Now, the $1 trillion question of glutathione. So glutathione, right? I don't like to just, I don't want you to think I'm just saying this off my mind. I am going to use medical research so that it's more, you guys can understand this better. Let's find this. Hang in there with me. Send me your questions. I will be answering your questions. And one person can join live with me at the end of this conversation. Okay, so I am talking to you. I have a whole file of medical research published in a lot of journals about glutathione because I usually like to research before I talk, and I talk science. So, in this publication of integrative medicine, so glutathione, okay, is a tripeptide. Now, glutathione is made up of 3 things, okay. Number 1 is cysteine, glycine, and glutamic acid. So these 3 peptides make glutathione, right? Now, glutathione is available in each and every cell in our body. It's not something that it comes from outside. Shajiha, I am only talking about skin lightening today. I will have live sessions like this where we can discuss about each topic. So today is all about skin lightening and whitening and whatnot, right? So glutathione is anyway in our body. It's produced by our cells, right? And it is a very, very important antioxidant. It's called the mother of antioxidants. So damn good to detoxify our body, right? Now, glutathione also facilitates plasma membrane transport of toxins, right? So glutathione causes chemical neutralization. I'm reading off the medical research, right? It helps regeneration of vitamin C and E, right? And neutralization of free radicals produced by phase 1 liver metabolism of chemical toxins, and one of approximately 7 liver phase 2 reactions which conjugate and activated intermediate produced by phase 1 to make them water soluble. It transports, this might sound like a little gibberish to you guys, but I want you to understand that there is, you should not, and one thing I want you guys to learn is do your own medical research, right? Now when you go on the internet, there's everybody's opinion on the internet, so you can't just don't Google type it. Go and read medical research on a particular subject if you really are interested. And it transports mercury out of cells and brain, and it's really important for mitochondrial function. So glutathione is really, really, really good for the body. And forget about skin lightening or whitening. You guys should all make sure that you have enough concentrations of glutathione in your system. Now, diseases associated with glutathione depletion. Now, what are the things that can cause, or what are the things that can happen if you don't have enough glutathione in your body, right? Now, we all have certain things, produced in our body, but when you lose glutathione, what can happen? Neurodegenerative disorders like Alzheimer's, Parkinson's, Huntington's, pulmonary diseases, immune diseases, cardiovascular diseases, and chronic age-related diseases, liver disease, cystic fibrosis, and aging itself. So, glutathione is so important to our body. But now, ape ammala, ape, in our society, they say, udara palaturu elawulu kæවොතින් hama සුදු වෙනවා, මැල්ලුම් කෑවොතින් කොණ්ඩේ දික් වෙනවා. They tell us that when we take vitamins, අපේ skin එක, අපේ hair එක හොඳට improve වෙනවා. So ඒක නිකමට කියන දෙයක් නෙමෙයි. ඒකේ there's a huge truth to it, because if you increase antioxidant concentrations in your body, right, then your skin can get, the complexion will be brighter, your skin will be better, you will have an amazing glow to your skin, right? So this is true. So that is why for some people, when they take this glutathione as an antioxidant into their body through oral pathways or through IV pathways, some people will see a glowing effect, right? But believe me, it's not that there is no world phenomenon saying that glutathione will make your skin fair. So if you believe it, that is completely wrong. Shajia is asking, what's the mechanism of vitamin C and E in lightening? Does it include both oral and topical methods? Which is better? Actually, topical and oral both have to be combined, because it's an antioxidant, and when you take it orally, some gets absorbed and some go away completely. And when you apply it topically, it lasts on the skin up to 48 hours if it's a good product. If it is combined with ferulic acid, then vitamin C can last on the skin for a longer time. So coming back to glutathione, the 100 million questions that I have got on as DMs and as comments. So you can have not only glutathione, you can have glutathione combined with other antioxidants in order to have a better skin. But the problem is, I told you, right, glutathione is made up of 3 amino acids. So when you take it orally, right, you have to take a hell of a lot long term, because in your tummy, glutathione breaks into these 3 and is absorbed. It is not directly absorbed as glutathione. So, these 3 products, they go into the body, and it has to come back together in the liver again to manufacture glutathione. So that is why it takes longer. But if you take it in a different way, like an intravenous, or in a system where there's 100% systemic absorption, then obviously the detoxification, the result, because the absorption, there's the bypasses the liver circulation, it's 100% absorption, the result comes faster. But the problem is, you need to know, imagine, I always tell this to my patients, are you okay with me speaking in Sinhalese? Because I feel some people might not understand. Let me know if you're comfortable with me talking more in English or more in Sinhalese, or a combination is better. Your feedback is important. So, imagine if we have a mango tree, right, at home, and you have about 100 fruits, right? Okay, talk in English, fine, okay. So you have like 100 mangoes in your tree. Just because mango is, I'll do a combination. So just because mangoes are really abundant, it's really great, right? Is it okay if we eat all 100 mangoes in the same day? Now everybody know that vitamin C really helps fight viral illnesses, right? So when vitamin C it's good during COVID time කියලා vitamin C බෝතලෙම එකපාර බිව්වම මොකද වෙන්නේ, right? Because ඕනම දෙයක් වැඩියෙන් ගත්තම, right, if you take something too much also හොඳ දෙයක් වුණා වැඩියෙන් කරාම ඒක side effects එනවා, right? It will be too much. So obviously some of these girls, and guys, they tell me that they go to certain places and they get massive doses of intravenous glutathione, sometimes not even by a doctor. Sometimes it's some random person in a house injecting God knows what. Because let's say you have a bottle and you dissolve and you're giving it to you. So are we that stupid that we don't ask what it is, we don't check for the credibility? Sudhu wenama kiyala, are we getting all of these things into our body, right? It's, please be responsible, please be careful about your own health, right? If you are not responsible, if you are not careful, nobody else will. So you have to be, when you are selecting any vitamin, whether oral, intravenous, anything, you have to make sure, not the price, you have to make sure that it is the best quality of product, it is the best medication, ingredient, and you're doing it with somebody who is qualified for the job, right? It's such a disgrace for your own self when you play with your own life and you take risks with your own life. Because සුදු වෙන්න කියලා health එක අමාරු දා ගන්න ඕනේ නෑනේ, right? So you have to be very careful. So well, I hope I answered your questions about glutathione. So in terms of, again, I am going to recap everything, right? If you want to have a better complexion, and if you want to improve your complexion, let's say you got darker or you got more pigmented for hormones, sun exposure, suntan, underarms, or due to polycystic ovarian syndrome, hormonal changes, or for some reason, and you want to have a better glowing, brighter skin, a selected skincare routine is important, right? And that also has to be focused skincare routine. Number two, you have to, if you want faster results, if you want, let's say your wedding is in 3 months, your wedding is in 2 months, and if you want, hi Shay, how are you? If you want, let's say, like some girls come and tell me they are afraid to wear their jacket because the entire back is a different color, or they're afraid to wear the sari because their tummy is of a different color, or their arm is darker. So if you want to really fix it faster, meet a really good cosmetic physician and experienced person, and then you can combine it with laser, you can combine it with peeling and different types of skin lightening, healthy medical treatments. And number three, if you want this glow to result into your entire face, arms, body, everything, then of course you can combine it with a oral antioxidant or a Vita drip antioxidant therapy. Now this is science, this is integrative medicine, right? But someone who knows the subject. Also, protection is very important. When you take antioxidants for the skin, if you're taking a lot of alcohol, right? If you are taking a lot of junk food, if you are taking toxins, and if you are going under the sun a lot, then whatever you're doing, you can apply the 100, you can apply such an expensive cream, you can be taking a very expensive vitamin antioxidant, you can be spending so much on laser or skincare products, but you can ruin it in 2 seconds when you get exposed to sun without sun protection, umbrella, or if you take a lot of toxins into your body. So having the right diet and lifestyle also is really important to have a successful or to have a good glowing, beautiful complexion. So we are almost at the end of our session. You can ask me questions you have so I can answer your questions. And if you want to join in live with me, you can request. I will accept one person to join in live and ask me the questions you want to ask. How about your one session high intensity medical skin lightening? So that is a really effective hybrid peel. We call them as hybrid peels. Now, you guys are really educated. You know there are peels, glycolic, lactic, salicylic, blah, blah, lots of peels. But rather than one peel, the high intensity medical lightening contains a combination of peels, and it works miraculously, magically, to reduce extreme pigmentation in just one session. It's one of the world's best treatments with a 98% success rate, better than laser, and it's really, really good. Is it okay to have glutathione orally long term? Himesh, again, like I told you, please ask the doctor before you take it, because sometimes, because glutathione, I told you, has cysteine, right? So for some people who have a family history of getting kidney stones, if you just take it without asking a doctor, right? Sometimes when you take these antioxidants or vitamins just without checking, it can cause problems. So long-term oral medication, I really don't agree with that, or antioxidants. Fazmana, is it okay to get microdox when people... Guys, please don't ask me other questions. I will dedicate one day for Insta Live for you to discuss one topic. So there's 150 people on this. Ask me anything about skin brightening or lightening. Bright Boost Peel is really good. Again, if you don't have an acne prone skin, it has a combination of glycolic and lactic acids, which helps to really nicely improve the texture and glow. Evening Primrose Oil is also, again, a really, really good supplement, especially for post-menopausal women. But because it has vitamin E, if you are on blood thinners, if you are on certain, psychiatric medication, you have to really ask a doctor before taking it. But in general, if you don't have any issue other than just anti-aging purposes, it's good. How often can we apply creams containing glutathione? Well, honestly, you can apply it once a day, but the problem is the brand has to be really good. Short-term, result-driven creams which sell the word glutathione, you have to be really, really careful, because people just use the name glutathione to sell whatever they can, and the products are sometimes not really great. Underarm is really dark. What can I do for it? You have to take a good skin lightening medication for intimate areas prescribed by a doctor, and you can combine laser therapy along with it to get faster results. What treatment is good to lighten, brighten the skin? So again, to lighten and brighten the skin, there are beautiful medifacials to brighten the skin, containing antioxidants, vitamin C. They give an instant glow to the skin. Then there's laser skin brightening. Then there's hybrid peels or chemical peels, but nowadays what's really in is hybrid peels. So you can have a nice combination of this along with a really good skincare routine and antioxidants. The cost of peels, they depend on each peel and on the requirement. Why is the glutathione injection so expensive? I don't really talk about glutathione injections per se. You need to select a right antioxidant. You have to select the product. It all depends on, there's a reason why good products, good services, good medication come at a particular cost. Because in Sinhalese there is always this saying, is my time up? Okay, there is always this saying that when something is really cheap, might not really be great. So I think my time is up. You can tell me, share with me whether you like this session. I'm gonna post this video. Comment, write all your comments, all your questions underneath it. Please, not as a DM, but as a comment. So I will reply to you. So if you have if you have a similar question, you can read other people's questions. And if you want feedback, if you want sessions like this in future, let me know. So hope you all have a really great night and see you. Bye.